Assalamualaikum and good evening. So today my team member and I am going to present our ECG poster. So we'll be starting from me. My name is Nur Fatia. So I'm going to present on the introduction. So an electrocardiogram is a painless, non-invasive way to help diagnose many common heart problems. A healthcare provider might use an electrocardiogram to determine or detect arrhythmias, blocked or narrow arteries in the heart causing chest pain or heart attack. Either the patient have previous heart attack, also we use ECG procedure, and also to check is following up with the pacemaker patient. So a patient might need ECG if you have this sign and symptom, which is chest pain, dizziness, heart palpitation, shortness of breath, fatigue, and rapid pulse. Normal ECG will form a complete wave of P, QRS, and T, where it will be considered as a complete heart cycle. So as you can see, here's the example of the P, QRS, T complete cycle wave. So for the P wave, it shows the atrial contraction. The QRS complex is to show the ventricular contraction. And the T wave is to show the repolarizing ventricles. So that's all from me. I will be passing to my next team member.
Okay, Assalamualaikum. My name is Sabina. So today I'm gonna talk about the few abnormality that we can see in the ECG. So my first point is ST segment elevation of myocardial infarction. So which we can call as STEMI. So STEMI occur when one of the coronary artery becomes completely blocked or cutting off the flow of the oxygen rich blood to a section of the heart. So to recognize STEMI in an ECG, there are a few ways. This is the criteria that we can see in the ECG. First, ST segment elevation in lead 2, 3, and LVF, which is as you can see in this poster at the red box, and ST segment depression in lead 1, LVL, V1, V2, and V3, which is in the green box here. And the green box are known as reciprocal changes to confirm that it is STEMI. So then next, I'm going to explain about ventricular hypertrophy. So there are two types of ventricular hypertrophy, which is left ventricular hypertrophy and right ventricular hypertrophy. So as you can see, both of this is a condition where it happened because of the pressure overload to the because of a secondary condition such as aortic stenosis and hypertension. So the difference between these two is left ventricular hypertrophy happens in the left ventricle, while right ventricular hypertrophy happens at the right ventricle. So to diagnose LVH, we know that there are a few criteria that we have to know. First, which is based on the ST elevation. So we can see, if you want to know that it is LVH, there are ST elevation at the anteroseptal lead, and at the anteroseptal lead there are prominent T wave. And next is we have to see at the lateral lead, they will be concave ST depression and asymmetrical negative T wave. And in LVH, the criteria is it must be left axis deviation. And to confirm that it is LVH, we have to look based on the Stokolow-Lyon index, which is as the height of S wave at V2 plus R wave at V5. You combine these two height and get more than 35 millimeter. So for RVH, we only look at the R wave and S wave. So the R wave we look at V1, while S wave we look at V5. So I think that's all from me, and I'm gonna pass this to Bustamam.
Hi. Okay. Hi and Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Muhammad bin Saimi. So now I'm going to explain about the pre-excitation syndrome, which also known as Wolff-Parkinson-White disease or syndrome. So this is a disease that related to heart condition. The heart is abnormally beat fast than the normal beat. So this causes the extra electrical connection in the heart. This problem can get from the congenital, which from the baby itself, from the baby. So from the ECG, we can see the criteria for the WPW is the most significant is the delta wave, as you can see the red arrow in the ECG itself. So next, the criteria is the QRS complex is widening with more than 0.11 seconds. And the last one is PR table is shortening with less than 0.12 seconds. So next is I'm going to explaining about the premature ventricular contraction, which is PVC, and premature atrial contraction, which is PAC. This PVC and PAC also known as the ectopic. So an ectopic heartbeat is a type of arrhythmia, which is the irregular heartbeat. It happens when the heart is contract too soon or too late, which is within the normal beat. There's another extra beat. This is called as an ectopic. So this will cause the patient having the tachycardia or arrhythmia or atrial flutter. So most of the time, the ectopic heartbeat is harmless and doesn't result from underlying heart problem or heart condition. So the WPW, the PVC and PAC only affect the beat of the patients. So the criteria from the ECG is PVC has broad QRS complex, while PAC has a normal QRS complex, as you can see in the ECG. The ectopic one, you can see there is a broad QRS complex, and the below one is the normal QRS complex. So PVC has a compensatory pulse after the beat, while PAC doesn't have any beat, compensatory pulse after the beat. So, and the last is both have the same, which is has no P wave. Okay, as you can see, the red arrow is the normal morphology of the P wave, where you can see there's no P wave at the ectopic. Okay, I think that's all for me. Now I'll pass to Shafika.
Okay, sekejap. Okay, so hi, I am Putri Nur Shafika. So I will explain about the bundle branch block. So bundle branches is bundle of His. It is divided into right and left bundle branches. And for the left bundle branches, it divides into septal, anterior, and also posterior vesicles. While for right bundle branch, it has no branch. It is not divided into small branches. And then for bundle branches, we will refer to the QRS complex. So the QRS complex will be more than 0.12, which is white QRS complex. And then first for the LBBB, which is left bundle branch block, it is first the right ventricle will contract first, and then the LV will contract. So we will look at the V1 and also V6 lead. For V1, it will have W shape, which is RS, and for V6, it will have notch or showing a M shape or rabbit ears. And then for RBBB, which is right bundle branch block, the left ventricle contracts first, and then the right ventricle contracts. So it is same as the LBBB, which is white QRS complex. And then for RBBB, we will look at the lead V1 and also V6. For V1, there will be RSR pattern. And for V6, there will be QRS pattern. So next, for the Okay, there are 4 types of AV block, which is the first one is the first degree. So first degree is the prolong of the PR interval. As you know, the normal range for PR interval is 0.12 to 0.2. So the first degree, it has prolong of PR interval, which is more than 0.2 seconds. And then the second one is the second degree type 1, which is the Wackenbeck. Okay, so for the second degree, it will have a drop beat. For type 1, the drop beat, for type 1, there will be progressively prolongation of PR interval, which is every beat, the PR interval is progressively prolonged, and then there will be a drop beat, and then it will back to the normal beat again. And then for the second degree type 2, there also will be a drop beat, but the PR interval is constant. It is different from the type 1. And then the fourth is the third degree, which is the complete heart block. There is no association between P and QRS complex. So that's all for me. I will pass to Natasha.
So, hi, Assalamualaikum. My name is Nurana Natasha Binti Muhammad Hawiz. So, I'm going to do a conclusion. So, in a conclusion, a non-invasive medical test that monitors and documents the electrical activity of the heart is called an electrocardiography. It is for the detection of heart issues such as bundle branch block, AV nodal block, ventricular hypertrophy, STEMI, WPW, PAC, and PVC. So, an expert healthcare provider should interpret an ECG since it needs specialized knowledge and training. And a wide range of cardiac disease can be indicated by abnormalities in the ECG waveform, and in some instances, rapid medical intervention may be required. So, overall, the ECG is a valuable diagnostic tool that can offer crucial details about the electrical activity of the heart and aid in making medical decisions. Thank you for that's all from us. Thank you.